Hello everyone. In this particular session of the pharmacology, we will be discussing the very important group of drugs, that is the anticoagulants. So anticoagulants are the substances which are mainly used in the treatment of the hypercoagulable disorders, right? And these are the substances which are used in the treatment of the peripheral arterial diseases or in the treatment of the venous thrombosis. Now, what are these particular drugs? Let me discuss. There are three major group of anticoagulants, right? We have three major group of anticoagulants. Now, what are the examples of this particular three major group of the anticoagulants? Number one, we have the Warfarin group, right? Number one, we have the Warfarin group, and number two, we have indirect thrombin inhibitors, that is Heparin group, right? Indirect thrombin inhibitors, that is the Heparin group, and direct thrombin inhibitors. So indirect thrombin inhibitors, they are the Heparin group. So if you see this particular heparin, it can be used both in vivo and as well as the in vitro, right? It can be used both in vivo and as well as the in vitro. Now, so if you see the classification of drugs given as the anticoagulants, we have the oral formulations and as well as the parenteral formulations. And if you take this parenteral formulations, they are given either through subcutaneous route or the intravenous route. Now, let me just classify the anticoagulants. So, we classify them as oral anticoagulants, and this particular oral anticoagulants, again we have three types, that is vitamin K inhibitors, right, vitamin K inhibitors, and the second one is the factor Xa inhibitors, and the third is direct thrombin inhibitors. Right, direct thrombin inhibitors. So these are the oral formulations or the oral anticoagulants. So if you take this vitamin K inhibitors, this includes warfarin, dicumarol, enoxaparin, and then phenandione. So we have warfarin, right? Then we have dicumarol, then we have enoxaparin, right? Then we have enoxaparin. Next we have phenandione, right? So these are the vitamin K inhibitors. Then if you take this factor Xa inhibitors, the examples are rivaroxaban and as well as the apixaban. Right? So one is your rivaroxaban and the other one is apixaban. So these are the factor Xa inhibitors. So then we have the direct thrombin inhibitors. This particular direct thrombin inhibitors, they include 𝐒𝐮𝐬𝐜𝐫𝐢𝐛𝐞, right? Then we have 𝐒𝐮𝐬𝐜𝐫𝐢𝐛𝐞, and the next important is dabigatran exilite. Right, so these are the oral anticoagulants. So we have the vitamin K inhibitors, then factor Xa inhibitors, then direct thrombin inhibitors. Then Apart from the oral formulations, the next what we have is the parenteral formulations. So, if you see the classification of the parenteral anticoagulants, that includes indirect thrombin inhibitors and as well as direct thrombin inhibitors. Right, we have indirect thrombin inhibitors. The next we have next we have direct thrombin inhibitors. So if you take this indirect thrombin inhibitors, what are the examples? It is mainly the heparins. But what are the various forms of heparins we have is, number one, we have unfractionated heparin, right? We have unfractionated heparin. Then we have the various forms of low molecular weight heparin. Now, what are the examples of your low molecular weight heparin? That includes Enoxaparin, right? And second, we have Dalteparin and 𝗠𝐭𝐼𝐴. Right, Dalteparin and as well as the 𝗠𝐭𝐼𝐴. So these are the various forms of low molecular weight heparin. And another important group of indirect thrombin inhibitors are fondaparinux and as well as hydroparinux. Right, fondaparinux or the hydroparinux. So these are the parenteral indirect thrombin inhibitors. So they can be given through subcutaneous route, or even if you take this unfractionated heparin, it can be given through the intravenous route as well. Now, what are the examples of your direct thrombin inhibitors? Direct thrombin inhibitors, like we have Hiruidin, right? And the second important drug is lepidin, right? The second important drug is lepidin. Then followed by that we have bivalirudin, right? And fourth we have argatroban, right? Fourth we have argatroban, then melagatron. Right, melagatron. So these are the examples of your direct thrombin inhibitors. Now, after having discussed about the classification of the anticoagulants, let me discuss in detail about the oral anticoagulants. So oral anticoagulants, we have vitamin K inhibitors, factor Xa inhibitors and direct thrombin inhibitors. Vitamin K inhibitors are warfarin, dicumarol, acinocumarin and then phenandione. Then factor Xa inhibitors, if you see, rivaroxaban and as well as the apixaban. And direct thrombin inhibitors, the examples like what we have is the 𝐒𝐮𝐬𝐜𝐫𝐢𝐛𝐿 and as well as dabigatran. And the parenteral formulations, like we have indirect thrombin inhibitors and direct thrombin inhibitors. Indirect thrombin inhibitors like unfractionated heparin and low molecular weight heparin. The examples of low molecular weight heparin is Enoxaparin, Dalteparin and 𝗠𝐭𝐼𝐴. Then we have fondaparinux and hydroparinux. Direct thrombin inhibitors, like we have the Hiruidin, lepidin, bivalirudin, argatroban and as well as the melagatron. Right, now let me take up the discussion in detail about the oral anticoagulants.